Why does my conventional gynecologist not know how to help me feel better? Why do they keep telling me there's nothing wrong and they can't check my hormones or that my hormones are fine? So I'm just going to be 100% honest with you guys, because I was a conventionally trained gynecologist and I practiced that way over a decade. And I'm here to tell you that what I learned in medical school 20 some years ago was already antiquated. We learn what they figured out back in the 50s and 60s, and that is still taught to us. It's a disease oriented model. So it's very much focused on diagnosing you with a disease that is recognized by insurance company. What is the ICD-10 code? You know, when I was in school, it was probably the ICD-5 or 6. I don't know. They keep updating these codes, and that means insurance companies will determine whether or not they are going to acknowledge that as a disease and cover the medication or surgery related to treating that. So insurance and big pharmacology, the big drug companies, absolutely dictates how medical students are trained, how residency programs are run. When I was in residency, it was commonplace to have a drug rep come in 2 to 3 times a week to bring us lunches and quote unquote teach us about their drugs. So it was always what drug treats what disease, and if there is no drug, what surgery treats that disease. And so that is how residents are trained. In every specialty, we are trained to focus on what drug will be the Band-Aid to that symptom to manage it. It's never about reversing disease, stopping the progression. It's very much focused on Band-Aid approach. So.